speaker is basically international speaker coming flew all the way from Australia. Let me introduce you to our first speaker. Our first speaker is Mr. Stuart Dobson. He's a Director for Clinical Support Asia Pacific Oncology Incorporated. Stuart is a cytotechnologist trained at the Victorian Cytology Service in Melbourne. He has 10 years of experience as a cytotechnologist in laboratory in Melbourne and London. However, for the past 14 years, Stuart has worked with the pathologists and cytotechnologists throughout Asia Pacific, providing training in the interpretation of liquid-based cytology, which is a Thinprep. So without further ado, I would like to call upon Mr. Stuart Dobson to give a lecture.
Thank you for that introduction. And it's a pleasure to be here in Langkawi. Today I'm going to speak to you a little bit about the Thinprep Pap test and also the Thinprep imaging system, which has already been touched on by Elizabeth Pringle in the previous session. Before I talk about the Thinprep technology, I always like to make a commendation of the conventional Pap smear. In countries with well-organised screening programs, the conventional Pap smear has been responsible for a reduction in cervical cancer mortality of anywhere between 50 to 70%. One of the greatest challenges of an organised screening program is recruitment of women. Those countries which have greater participation in the screening program typically have the greatest reductions in disease. But the quality of cytology also varies from nation to nation, and sadly, despite the success of the screening program, some women who have been participating in screening still develop cervical cancer. And we understand that the conventional Pap smear does have a significant false negative rate. The landmark studies which have looked at the sensitivity of a conventional Pap smear estimate that for detection of high-grade disease, its sensitivity ranges from 52 to 58%, depending on whether you're looking at high-risk or screening populations. The Thinprep method was FDA approved in 1997 in response to concerns about the accuracy of the conventional Pap smear. The method now is used widely in many organised screening programs. The method itself involves collection of a cervical sample with plastic collection devices. The cells are collected in the same way, but rather than a smear being prepared on a glass slide, the cells are rinsed into a liquid. In the case of Thinprep, that's a methanol-based solution. Once the cells have been collected into this solution, it starts to work on breaking down the blood and the mucus, and it preserves the cells. This specimen is then sent to the laboratory, where they use a processor to help place a randomized portion of those cells onto the slide in a thin, even layer. The Thinprep method uses a membrane transfer methodology. Cells are collected onto a membrane which has 8-micron pores in it. Once the membrane is completely covered with cells, the glass slide is touched against it and the cells are transferred to that glass. There's no loss of cells in this process, and it creates a slide that is thin and easy to read, and also has been shown in clinical studies to be more accurate for the detection of high-grade disease. I haven't got time to go through all of the peer-reviewed literature, but let me tell you there are over 200 studies in the peer-reviewed literature which have looked at the Thinprep method, and there's a consistency in the improved detection of high-grade disease, an improvement in the ratio of the reporting of ascus to squamous intraepithelial lesions, and a reduction in unsatisfactories. In the United States today, liquid-based cytology is the basis for screening. It accounts for over 90% tests. Around 75% are Thinprep and 80% of physicians are using this method. The United Kingdom introduced the liquid-based cytology methods as a complete replacement to the conventional Pap smear in 2005 following independent sponsored clinical trials by the National Health Service. It's important to note that the use of the Thinprep method in the United Kingdom is very specific to certain geographies. For example, the Thinprep is used exclusively in Scotland and in the south east and southwest areas of England. It's also important to note these are the areas or the strategic health authorities with the lowest rates of cervical cancer. In Australia, Thinprep and liquid-based generally is used as an adjunct to the conventional Pap smear. So women attend for their Pap smear, and if they elect to pay an additional fee, after the conventional Pap smear is prepared, the remaining material on the device is rinsed into the liquid-based collection vial. That slide is then screened side by side the conventional Pap smear, and it has led to increases in the detection of biopsy-confirmed disease. In Australia, there are approximately 48 laboratories reporting more than 8,000 gynae cytology samples a year. 47 of them are utilising the Thinprep method. Several of them also use a competitive method. In New Zealand, they, as you have just learned, introduced liquid-based cytology and automation in 2009, and you've heard the experience from the largest lab in New Zealand in the previous session. Whenever you're looking at the performance of a test after its introduction, it's important to observe the trend over a period of time. When we look at Scotland, which was an early adopter of the Thinprep method exclusively, when the Thinprep method was rolled out, we saw an increase in the detection of high-grade disease, as you would expect if the test is performing better. Over time, the disease pool decreases, and then we start to see a reassuring downward trend for detection of disease. The Thinprep Pap test is also making an impact in the United States. In 1997, when the Thinprep method was FDA approved, it quickly became the standard of care, and today, as I mentioned, its market share is probably close to 75% of all Paps in the United States. What we did see is a very reassuring further reduction in cervical cancer cases. And this has coincided with an increase in the use of the test. It certainly is a positive trend. The FDA approved the Thinprep Pap test back in 1997. It has the broadest FDA labelling claims of any liquid-based cytology. It's the only liquid-based cytology test the FDA deems to be significantly more effective for the detection of cervical cancer precursors. It also improves specimen quality according to the FDA. It has been responsible in a separate high-grade multi-centre clinical trial for a 59.7% increase in high-grade disease detection. It remains the only liquid-based cytology method FDA approved as improving the classification and detection of glandular lesions. The only FDA-approved liquid-based method for the testing of HPV from the vial, and there are 3 FDA-approved tests at this point, all only approved out of the Thinprep vial. Chlamydia and gonorrhea testing can also be performed with some of the most popular PCR systems, according to the FDA. And as you have recently just experienced, some information about the Thinprep imaging system, which was FDA approved in 2003. When it comes to collecting a liquid-based sample, the quality of the test still depends somewhat, or largely, on the quality of the sample that's collected. It's important that the cervix is visualised when the sample is collected, and the patient assessment guidelines for liquid-based cytology are the same as the conventional Pap smear. It's ideal that a Pap test isn't scheduled during menses, not just because of the amount of blood that might be present, but also because of the complex morphology associated with the shedding of cells of endometrial origin that can sometimes lead to false positive cytology diagnoses. Lubricants should be avoided when using speculum. In most nations, the recommendation for insertion of the speculum is to use warm water as a lubricant. If lubricants must be used, and sometimes it is necessary perhaps in a postmenopausal patient, then a lubricant should be applied to the shaft of the speculum using a gloved finger. It's important that you don't allow the actual lubricant to pull around the cervix. So applying it to the tip of the speculum is not ideal. Lubricant collected into the Thinprep vial or on a conventional pap smear for that matter can impact the cellularity of the sample. So that's an important point. When it comes to collection, we recommend that the sample is rinsed from the collection device and then the collection device discarded. We don't recommend that with the Thinprep method the collection device head is dropped into the vial without rinsing. Our rationale for that is because mucus is often caught on the collection device, and when it comes into contact with the methanol-based fixatives, it will cause coagulum to develop. The cells will be trapped on that device. And whilst they may be in the vial in entirety, they're not floating freely in the solution. They're not available to the subsequent slide preparation. Spatula should be used in combination with the brush, or alternatively, a broom-like device can collect an endo and ectocervical sample simultaneously. The spatula is generally rotated on the face of the cervix 360 degrees and then whisked in the Thinprep liquid for about 10 seconds, just like beating an egg, before discarding the spatula. The brush, it needs to be inserted into the cervical os with the bottommost bristles still visible, and 1/4 to 1/2 turn only. Any additional turning can cause trauma to the endocervical canal. It creates bleeding as well as distortion of cells collected. The brush is just rinsed by running it around the edges of the vial under the liquid about 10 times. The broom-like devices are very popular and effective. Rotate the broom 3 to 5 times with the longer bristles inserted into the cervical os and the lateral bristles touching the ectocervix. And then when it comes to rinsing, crush the device head rigorously on the bottom of the vial at least 10 times. You can't damage the cells in this process, so be vigorous. Okay, so I'll move quickly now. I will just touch upon this rather than go into any detail, but as I've mentioned earlier, the Thinprep method has made impacts on the detection of glandular disease according to studies deemed acceptable by the FDA. Some of these studies have shown significant increases in the sensitivity for detecting adenocarcinomas with fewer false negatives. But most of the studies actually show improvements in specificity in particular. So that means fewer false positive glandular diagnoses. And these are important because these are investigated often radically, even in the absence of a colposcopic abnormality. The Thinprep imaging system, as Elizabeth Pringle has just presented, is now the technology which further improves the accuracy of the cervical cancer screening, but also offers significant productivity gains in the lab and allows us to overcome some of the challenges that we have in our countries with regards to a shortage of trained cytotechnologists. The Pap is collected in the same way, it's processed, a new stain is applied to the slide which affords near stoichiometric darkening of the nucleus in relation to its DNA content. That slide is then processed by an imager which selects 22 fields of view on every case. The cytotechnologist is swiftly taken to those 22 fields of view at the press of a button. If there's no abnormality in those fields of view, no further screening of that slide is required. The typical productivity gains that we see are often more than double manual screening rates of the same slides. Of course, any abnormality detected in the fields of view requires a full screen of the slide. These benefits to you include a reduction in false negative results and an improvement in the turnaround time. And this has been borne out in clinical trials, which I won't go into any great detail, but there's a significant body of evidence supporting the use of the Thinprep imaging system in the peer-reviewed literature. Finally, and very briefly, I would just like to talk to you a little bit about an interesting and recently published study. The College of American Pathologists, every several years, requests a survey questionnaire from all labs reporting cervical cytology in the United States. These results of this study form the benchmarks for the performance of the laboratory in the College of American Pathologists Laboratory Accreditation Program. The results of the most recent report of this survey showed some interesting findings. The liquid-based methods were statistically significantly more likely to detect low-grade lesions, and specifically the Thinprep Pap test showed a statistically significant increased reporting rate of high-grade lesions. All of the tests had a very similar ascus to SIL ratio, so this suggests that whilst there is increased ascus, the amount of disease, this type of reporting relative to the amount of true squamous intraepithelial lesions detected was favourable. Final slide. The future, perhaps, is something that is being discussed here today. In Australia, for example, we have one of the longest experiences so far with the HPV vaccine. What will happen once vaccinated women start to dominate the screening age? Well, what we will see is a reduction in the burden of disease. This will absolutely, and is a given, that it will reduce the positive predictive value of the cytology-based screening. Fewer needles in the haystack to find. And new technology such as the Thinprep imaging system, which is more accurate, plus enables cytotechnologists to maintain their skill base by exposing them to twice as many cases a day, will be possibly a very effective option as we may transition into potentially HPV testing as a primary screening tool in the decade or decades to come. So in conclusion, Thinprep has proven to be more effective. It's able to be read with the imaging system, which is further improves detection of abnormalities and offers improvements in productivity. And the Thinprep collection solution is the FDA-approved solution for HPV testing out of the vial. And we do recognise that HPV testing has a role to play in the future of cervical cancer screening programs. Thank you. Terima kasih and selamat tinggal. Thanks for your time today.